كنت راكب أنا وابن عمي دراجة نارية طبعا، كنا متوجهين على البلد. قبل ما نتوجه على البلد كنا رايحين على المحكمة، بدي أجيب عقد الزواج أنا فوقفت عند المحكمة لقيتها مسكرة، فمشينا على الفزبة فشفت حالي بطير في الهواء. عبد الله اسماعيل صالح ابو هربيد، فلقيت انه رجلي رايحه هيك على جنب ومفتفته، ولقيت ايدي مفحوره فيها شظيه. بعدين غيبت، صحيت لقيت حالي في سياره وغيبت مره ثانيه، فصحيت في مستشفى كمال عدوان، فجهزوني وحولوني على الشفاء. مش قد بقدرش اتحمله نهائيا، فلقيت برابيش طلعات محاليل من هنا ومن هنا وظليت قاعد في المستشفى عبال ما قرروا بتر الرجل.
Abdullah, probably the most severely injured patient we've come across that we saw on our first visit, and it's great to see him doing so well now. He's back at home, he's looking healthy, he's gaining weight. My name's Naveen Kavale. I'm a plastic surgeon that's based at King's College Hospital in London, which is a major trauma centre. I came to Gaza because this was where the need was. Orthopaedic surgeons from King's have been coming here since 2009 and providing training, and then the most recent conflict increased the sort of more acute need for more orthopaedic surgeons and plastic surgeons. On one particular night there were 200 injured that came in within half an hour, 70 of whom needed surgery. And they were all operated on and essentially patched up as best they could at the time, and then cleared out of the hospital to make room for the next wave of casualties.
Most of the injuries that we've seen are related to explosive injuries, shrapnel, some crush, and a few gunshot wounds. So we're talking about high energy transfer injuries, which basically means that the bone's very damaged, there's a big open wound, so the bone is exposed, or in fact there's even bone loss. I'm Sarah Phillips, I'm a consultant orthopaedic surgeon at King's College Hospital. The first trip in August was at very short notice. We've then been coming on a monthly basis since then to help train, to provide equipment, to increase capacity, so hopefully in the future patients will not necessarily need to be transferred out of Gaza for treatment, and also to treat patients ourselves. If I can teach or train or operate on patients in places that have less capacity or overwhelmed with casualties, etc., then I should help to provide care and help for those people and to help the doctors.
استكشف لقى انه من المستحيل ان الرجل تظل، لانه كان في تهتك في العضلات وفي العظام وفي الاوتار فيش الا جلد ضايل بس. حسيت حالي انسان بالعرب من المعامله تاعتهم الي. طب ما هو الواحد يعني اشي وصار فيه، يعني لو قلت لا خلاص اشي موجود، ليش نزعل يعني مثلا؟ جاي مستقبل كبير جاي قدامي لسه.